do you choose the right fasting method for you? You might be interested in intermittent fasting, but with so many different options, I know it can get a little bit confusing. So you need to ask yourself a few questions. Would you rather fast every day? Then you choose daily time-restricted eating. Do you want to only fast on certain days of the week? Then you would choose 5-2 fasting or alternate day fasting. Are you fasting for weight loss? Then you choose a longer fasting window, like 16 or 18 hours of fasting, and perhaps graduate to OMAD, that's 1 meal a day, or alternate day fasting. Do you need to take medication with food? Then daily time-restricted eating would be the best because you can eat every day. Is calorie counting or restricting your portion sizes stressful or difficult for you to do? Then you would avoid 5-2 fasting, in which you eat small portions of food 2 days a week. So there are a couple of common questions I get about intermittent fasting. First of all, can I exercise while I'm fasting? And the answer is yes. If you're just getting started with intermittent fasting, I would suggest that you start with some light walking for short periods of time. As you adjust more and you get more used to fasting, then you can progress to something a bit more strenuous. You can exercise, and exercise has lots of wonderful benefits, but you don't have to exercise to lose weight. And I know that if you're carrying a lot of weight, you may have some difficulty with movement, you may have pains in your joints, you may not have any energy. That's okay. As you go on with the fasting, as you lose the weight, as you lighten up, you may find that you naturally have more energy, that the aches and pains subside a little bit. So that will make it easier for you to naturally gravitate towards being more active. Can I drink alcohol while I'm fasting? No. Won't I faint if I don't eat 3 meals a day with lots of snacks in between? Won't my blood sugar drop too low? No, you won't faint. When you're not eating, your body takes the glycogen that's stored in your liver and breaks it down to give you glucose. Then that glucose travels around your body and is used as fuel for energy by your cells. Even when the glycogen is depleted in your liver, your body still has a backup mechanism where it produces glucose in a process known as gluconeogenesis. It produces glucose from other substrates, from amino acids, from fatty acids. Your body has these mechanisms in place to make sure that your blood sugar never drops below a certain point. You will not become hypoglycemic. You will not faint. Won't I be really hungry if I don't eat? And the answer is no, not really. You may feel a little bit of hunger, especially when you're just getting started with intermittent fasting, but gradually you adjust, and you may also find that some of what you're thinking of as hunger is just 1, boredom, 2, you're dehydrated and you need some water. So there are easy ways to get around that hunger, and I've talked about those in the video that I've linked in the description. Won't I feel really tired when I'm fasting? And again, no, not really. A lot of people find that they actually have more energy when they're fasting. They get more done. And if you're feeling really tired during your fasting window, there are a couple of things that might be going on. You might not be getting enough water. You might be dehydrated. You might not be getting enough electrolytes. So you can solve both these problems by taking a pinch of salt and putting it in a glass of water and drinking that. Also, you can add some magnesium supplements, and that can also help. I'm vegan, I eat low carb, carnivore, low fat. Can I still fast? The answer is yes. What you're eating is less important than the timing of your food. What we want is for there to be certain periods of your day when you're eating and periods when you're not eating. I have diabetes. Can I still fast? The answer is yes, you can. Some people have used intermittent fasting to reverse their pre-diabetes and type 2 diabetes. In the next video, I'll show you how to do that safely.